Let's see the blood supply of testis. So the arterial supply is mainly by the testicular arteries. So there are right and left testicular arteries which arise from the abdominal aorta. So these are the branches of abdominal aorta and which arise usually inferior to the renal arteries. So we can see the renal arteries. Just below the renal arteries we see the testicular arteries gaining its origin. And not only the testicular arteries, the arteries like cremasteric artery and artery to the vas deferens also supply the testis and gives a collateral circulation. So a rich collateral arterial supply comes from the internal iliac artery via the ductus deferens artery, artery to ductus deferens. So here we can see this is the common iliac artery which divides to form internal iliac and external iliac artery, and internal iliac gives rise to artery to the ductus deferens. This also provides a collateral circulation, and the next route of collateral circulation is via the inferior epigastric artery. So inferior epigastric artery is via an artery called as cremasteric artery. So via the cremasteric artery it provides collateral circulation, inferior epigastric artery. So we can see here this is the inferior epigastric artery. And the third is from the femoral, it's a sub branch from the femoral via the external pudendal artery. So from the thigh we can see the external pudendal artery ascends up to supply the testis. So external pudendal artery. So these are the collateral branches. So the collateral circulation is sufficient enough. It allows the ligation of testicular artery during surgery. So that is about the collateral circulation and testicular branches supplying the testis. Next, regarding the venous drainage, the venous drainage is mainly by pumpeniform plexus. We can see here the grapevine like plexus. It appears to be like grapevines, so it is called pumpeniform. So pumpeniform plexus of spermatic veins is present in the surface of epididymis and they run parallel to spermatic arteries. So these run parallel to the spermatic arteries, and this provides counter current exchange of heat and testosterone between the two vessels. So the plexus actually they are meant for the counter current exchange of heat, and next is testosterone, exchange of testosterone between the two vessels. So testicular veins are formed from the union of these pumpeniform plexus around the testis. So we can see they are all joining to form testicular veins, and we can see the right testicular vein drains directly into the inferior vena cava, whereas the left testicular vein is draining into the renal vein on the left side. So the right testicular vein empties into the inferior vena cava and left testicular vein empties into the left renal vein. This is clinically very important because of a longer course and opening into the left renal vein. Left side varicocele is more common than the right side. Next, regarding the lymphatic drainage of the testis, it drains into lateral aortic lymph nodes. The testis drain into lateral aortic lymph nodes which are called as para-aortic lymph nodes and which are along the testicular vessels. So we can see the testicular vessels which drains into lateral aortic lymph nodes. And scrotum drains into superficial inguinal lymph nodes. Scrotum here we can see it is draining into superficial. So this difference has to be understood. Testis is draining into para-aortic lymph nodes, whereas the scrotum drains into superficial inguinal lymph nodes. Then the epididymis, next we shall talk about the epididymis. It is usually of 6 meters in length. It is a highly coiled structure. Imagine 6 meters means how long it is. So it is a highly coiled structure, and it helps in the propulsive movement. So it propels the spermatozoa to move. So it is a coiled duct which is muscular, and where it continues into the ductus deferens. And if you see the parts of the epididymis, it has got the head. This is the head of the epididymis, then the body of epididymis, then tail of epididymis. Tail continues into ductus deferens or vas deferens. So the sperms undergo maturation and gain a progressive motility in the epididymis, and the sperms are also stored in the epididymis until ejaculation. So here we can see histological image of epididymis, where it is lined by ciliated columnar epithelium. So the cilia here are doesn't move, so they are stereocilia. So these is columnar cells, ciliated columnar cells. They help in resorption of testicular fluid. They also, their main function is like phagocytosis of degenerating sperm or degenerated sperm or spermatid residual bodies, and they help in the secretion of glycoproteins. So this is the main functions of epididymis. So the glycoproteins which bind to the surface of the cell membrane of sperm, and sialic acid and glycophosphorcholine, which inhibits capacitation until the sperm enters the female reproductive tract. So capacitation is the process of last changes happening in the sperm, and this process usually happens only when the sperm enters into the female reproductive tract. So where sperm undergoes fertilization with secondary oocyte. So continuing with the functions of epididymis, the tail of the epididymis, if you see the tail of the epididymis, it is quite muscular. So the muscular coat contains three layers, that is inner longitudinal, middle circular and outer longitudinal layer of smooth muscles, and these layers contract to force the sperm from the tail of the epididymis to the ductus deferens. So the process of movement from the epididymis to the ductus deferens is called as sperm emission. And after the sperm have been in the epididymis for around 18 to 24 hours, they develop the capability of motility, even though several inhibitory proteins in the epididymal fluid still prevent final motility until after ejaculation. So the transit of the sperm have been like in the epididymis, usually they will be around 18 to 24 hours until they develop the capability of motility, and the transit of the sperm through the epididymis is thought to take up to 12 days. So though the sperm may be stored in the epididymis for several weeks. And once ejaculated into the female, the spermatozoa move into the uterus and to the isthmus of the uterine tubes to undergo capacitation. The capacitation is the final maturation of the sperm, and the spermatozoa have a lifespan of approximately 24 to 48 hours within the female reproductive tract. So let's see some questions related to this topic. Sperm acquires motility in. So I hope you would be knowing the answer. Seminal vesicles, testis, epididymis, ejaculatory ducts. So obviously in the epididymis. So sperms undergo maturation and gain their progressive motility in the epididymis and are stored until the ejaculation in the epididymis. Let's see the next question. The capacitance of the sperm takes place in. So it takes place where? I hope you all know the answer. Seminiferous tubules, epididymis, vas deferens, uterine tube. So answer is of course uterine tube. It takes place in the isthmus of the uterine tube, and capacitated sperm can fertilize the secondary oocyte at the ampulla of the uterine tube, which is the site of fertilization. Thank you. The answer. Next question is left testicular vein drains to. This is an important clinical aspect question. So it drains into left renal vein, inferior vena cava directly, superior vena cava, hepatic vein. So answer is left renal vein. So left testicular vein empties into left renal vein and right testicular vein empties directly into inferior vena cava. So because of a longer course of left renal vein, left varicocele on the left testis commonly shows the left varicocele than the right. And here is the last question of today's session. Injury to which nerve during a herniorrhaphy may cause paresthesia at the root of the scrotum and base of the penis? Ilioinguinal, pudendal, genitofemoral, iliohypogastric. So what would be your answer? So during herniorrhaphy, ilioinguinal nerve is damaged while working with the inguinal canal. So the answer is inguinal nerve. Whereas the iliohypogastric nerve may be damaged while putting the incision for herniorrhaphy, and that is in the inguinal region. And ilioinguinal nerve pierces the internal oblique muscle and distributes its filaments into it, and accompanying the spermatic cord through the superficial inguinal ring, and is distributed the skin of the upper and the medial part of the thigh, and like a medial part of the thigh, and locations in males and females. In males, it supplies the anterior part and continues as the anterior scrotal nerve, which supplies the skin of the anterior part of the scrotum and also the skin over the root of the penis. Then in females, it continues to form anterior labial nerve, which supplies to the skin covering the mons pubis and labium majus. The nerve does not pass through the deep inguinal ring, and therefore it is only travels through the inguinal canal. That is the importance of ilioinguinal nerve. Iliohypogastric nerve also may damaged. So iliohypogastric nerve supplies the skin over the iliac crest, upper inguinal and hypogastric areas, but not the scrotum and penis. So that is the reason the answer here is ilioinguinal nerve, because the paresthesia is felt at the root of the scrotum and base of the penis. So that is the terminal supply of ilioinguinal nerve, and which is a part of inguinal canal. So thank you. I hope you understood this topic.